Welcome to week 7. I can't believe this semester is almost over. And this week we will be discussing the last 3 chapters in the textbook, chapters 19, 20, and 21. In chapter 19, they present how to strategize your evidence-based practice. And the first thing you do is developing that PICO question and then assigning it to a clinical category. The therapy category is probably the one that you'll be focused in if you're on that EBP committee. So you'll use an experimental, quasi-experimental, sometimes a non-experimental, with an outcome that is known, and you'll be using some type of a therapy appraisal tool. It's unlikely that you'll use a diagnostic category, a prognosis category, or a harm category. In the second step, you'll search the literature, and we did that again early in this course. This helps develop information literacy. It's always helpful to consult a librarian, and I believe I mentioned early in the course that we have reference librarians on hand here in the Mount Aloysius Library that can help you find appropriate literature for your projects. And I hope you contacted them to help you succeed in this course. It's helpful to use electronic indexes and databases like we have here at the Mount. A lot of students usually use ProQuest or PubMed. They are excellent resources to find those evidence-based practice peer-reviewed journal articles. There's also web-based tutorials to search a database, and I provided a homegrown one early on in the course, and you will have access to those videos even after the course. They're up on my public YouTube channel, and if you need to in the future, you can always go in and search for my channel. So ask yourself, when you're looking for articles and references for your EBP project, is it a peer-reviewed journal? You really should be looking at peer-reviewed journals. Is the setting similar to the one where you're working? And is there any study sponsorship? Be careful with sponsorship. If a study is sponsored by a commercial company, they may have funded the research, and the results may be skewed toward positively toward that company. You also want to make sure that your references are current. So try to limit those references to the last 5 years. You can go back a little bit further, but with caution, because a lot of times the evidence changes as we learn more. So the therapy category, like we discussed earlier, usually experimental randomized control trials or intervention studies. Was there a difference between 2 or more interventions? Are the numerical values continuous or are they discrete? And you can go back and remind yourself what those mean in this chapter in the textbook about statistical analysis and variables. Do they measure outcomes using discrete variables? How do they present the results? Is it a relative risk, an odds ratio, or a relative risk reduction? Or the number needed to treat, like how many patients do we have to apply this particular intervention in order to have favorable results? Also look at the confidence interval and that null value. And again, all of these things can be found earlier in this textbook if you need a refresher. I'm not going to spend a whole lot of time. You will see sensitivity and specificity outlined in your textbook. One has to do with a positive positive value and a negative value. You can also look at the positive predictive value and the negative predictive value and the likelihood ratio. For prognosis articles, you'd look at odds ratios and harm. It's used to determine if an individual has been harmed. Might be a case control design, and it measures the association that best describes the analyzed data in case control studies. Finally, look at meta-analyses. These, as we discussed last week, these pool all of the data in similar articles, and they have a higher level of evidence. So again, it uses that clinical question to guide the process, and it is a higher value. It's higher on that hierarchical pyramid. So I would encourage you to try to find those meta-analyses. Look at the Cochrane review. So evidence-based practice is about integrating your clinical expertise and what you're finding in the literature, and also patient preferences. So it's also helpful to pull out those qualitative articles, see what you can find about what patients think about different interventions, and then apply those to your evidence-based practice project. Moving on to chapter 20. The use of EBP is expected nowadays in hospitals, and it is one of the founding pillars in a magnet hospital. You need to use strategies that address the systems of care, practitioners, leadership, and healthcare cultures. So it really is a cultural shift in many places. And the acronym is TRIP, Translation of Research into Practice, and it involves promoting the adoption of evidence-based practice that goes beyond just sharing the information, but goes into practice. Okay, conduct of research. We've been talking about how to analyze and critically appraise the research that you found in your particular project. So through this course, I hope that you've been able to learn a little bit about how researchers conduct research, and that you'll be able to apply that when you read through these EBP articles in order to apply them to your practice. Translation science is implementation science. It focuses on testing those interventions that you read about in the articles that you retrieved from your search. What works? What doesn't work? And hopefully we can improve the uptake and the use to improve patient outcomes. I know I've said it before in different presentations that we're nurses for a reason, and we want to be able to get our patients back to that full measure of health, improve their quality of life. We want to get them out of the hospital so they can get back to living. So why wouldn't we want to apply the latest and greatest evidence that was done by someone else in order to get our patient population back to that full measure of health, or back to that optimal quality of life? And that's why we do evidence-based practice. One of the models used is the Iowa model, and I'm not going to go into it to help shorten this presentation, but the authors of your textbook go into more detail on that Iowa model. So I encourage you to read through that Iowa model. So there's 11 steps or 11 slides to the steps: selection, forming a team. You really don't want to do this alone, and you'll want to make sure that it's interdisciplinary and including the stakeholders. Stakeholders means anyone who has skin in the game, anyone who has a vested interest in improving this uh, evidence-based practice um, topic. So you might have to include senior leadership or look at your different disciplines in the hospital. Is it pharmacy, physical therapy, lab, housekeeping, dietary? Who has skin in the game? You'll want to include everyone, a representative from every discipline. Assign evidence retrieval to different members of the team. You'll want to look for relevant and related research and classify the articles. You'll want to read and critique articles just the same way we've done in this course. This course really was designed to help you be that novice consumer of research. So you'll be able to be on that team of EBP or clinical practice guidelines so that you can improve your patient outcomes. You'll have to grade the evidence for quality and strength the same way you did as you critique the articles for your EBP paper. You'll also want a group approach so that it helps distribute the workload, helps to understand the scientific basis for the practice change, and it also helps us all use research-based language. It helps us gain credibility with the interdisciplinary team. Think about when you're speaking to other providers or other members of the healthcare team. When you're using appropriate language, you will be viewed differently. And then also, as you gain experience with reading the literature, please pass your knowledge on to the novices. They need some mentorship and help as they gain knowledge so that then they in turn can provide mentorship. You'll have to decide which studies to use, just like you decided which studies to use in this course. A summary table is it's helpful. This slide says essential, but I did this when I did my dissertation, and it's just a grid along the left-hand side of the table. You list all your articles, and then across the top, you would then include all of the elements on the bullet points there. And this helps you, at a glance, group articles to make more sense. Then you'd want to develop your recommendations based on all of the review of the articles and the critique and the analysis and the consensus of the group. You'll want to put forth your practice recommendations. And again, this is similar to what you're doing in your EBP paper. You'll have to decide which relevant items to change in your practice in order to improve patient outcomes. And all of those bullet points are relevant. You'll want to consider all of those. You develop your evidence-based practice, then implement it. Development is one thing, but without implementation, no change will take place. So you'll need to apply the TRIP model that we discussed a little earlier and communicate it out to the members of whatever social system, your unit or your division, department, and so forth. This slide goes more into the implementation strategies, and you'll want to apply change theory in order to implement the changes that you hope to make in order to improve your patient outcomes. And again, strategies all involve change theory. And it would be a good idea to learn about these change theories and identify which change theory is appropriate for the promotion and adoption of this new practice for evidence-based practice outcomes. After you adopt the new practice, you'll want to audit and seek feedback from the users so that you can see whether the practice is being adopted and to see whether the outcomes have changed. You'll want to continue to meet with key leadership stakeholders just to kind of take the temperature of those stakeholders, see how it's working interdisciplinary in their departments. Providing recognition and rewards also is helpful. Change is hard. You all know that. You've all changed a whole lot throughout this semester. So you know how hard change is. And I might be wrong, but I bet that you've also had to do some kind of a practice change in your career. So providing rewards, positive reinforcement for those practice changes goes a long way. So try to build that into your EBP project. It doesn't have to cost a lot of money or any money at all. Sometimes a pat on the back or a kudos is enough for some individuals to continue that practice change. And then finally, evaluation. There should be a structured approach to evaluate the impact of that EBP change. So make sure that you don't skip this last step. Then future directions for EBP. It does take a lot of work. So you'll want to, or the leadership will want to build organizational capacity. It's difficult to work on more than one EBP change at a time, but some units have many EBP projects going on simultaneously, and it does take a lot of capacity. Moving on to Chapter 21, Quality Improvement, and this is one of my favorite topics. Quality healthcare is care that's safe, effective, patient-centered, timely, efficient, and equitable. And you should be using quality data to monitor the outcomes of care processes. Using quality data then helps us formulate that PICO question and steers us in the direction to evidence-based practice. Our role as a nurse, and I know that I'm speaking to multidisciplines here, so please apply this to your discipline. Your role, the nurse's role in healthcare QI, is to effectively influence improvements in the work setting and then ensure all patients consistently receive excellent care. I've said it before, we got into this business to help people, and we want to make sure that we get people back to their quality of life and back home as quickly as possible. So we should be aligning the national organization and unit level goals for QI. If you're not sure what those QI measures are, a lot of units in hospitals nowadays do have a quality board, so take a look at that. Try to think of what drives those quality measures, like accreditation or payment. Quality measures like the HCAP scores. You know that HCAP scores are tied to reimbursement. Nursing sensitive indicators like pressure ulcers, hospital acquired infections, and the like, they are all tied to payment. So it really behooves us as nurses to participate in evidence-based practice and quality improvement. Without full reimbursement for patient stay, whether it's Medicare, Medicaid, or private insurance, that will affect hospital revenue, and it'll affect the equipment that the hospital can purchase, the supplies that the hospital can purchase. It affects hiring, and it also will affect your paycheck. So it really does behoove all of us nurses to participate in QI. So I've already talked a little bit about this healthcare improvement. We want to provide better care, more affordable care. We want people to be healthy. We want our communities to be healthy. We want to transition from volume-based to value-based care. We need to start, or we need to continue and dig a little bit deeper into those social determinants of health, looking at the economic stability of our patients. Education has a lot to do with literacy, not just being able to read and write, but healthcare literacy. Do they understand what you're telling them? Patients are embarrassed when they don't understand the lingo or don't understand, so they may say that they do understand, but they may not. And then they may not be able to comply because they really don't understand. So these are strategy levers, excuse me. So please read through these different bullet points, and definitely look at your textbook and read through the different strategy levels to be able to understand each of these a little bit more deeply. I mentioned a little bit ago, there are nursing sensitive quality indicators, and you can look for that online. Benchmarking is a way to gather information about processes or performance and to analyze performance differences between different business units. And benchmarking is used to develop improvement needs. QI models emphasize customer satisfaction. Think about your HCAP scores, teams and teamwork, continuous improvement of work processes, transformational leadership, the use of data to make decisions. And I just love that we have electronic health records. It's so easy to data mine our electronic health records to look for opportunities for improvement. So use the data to make decisions. Not sure whether you've had healthcare informatics yet, but learn the principles in that course so that you can dive into the data to help steer your unit in a direction to help improve patient experience and outcomes. And then also, we want to make sure that we standardize work processes, and QI helps us to do that. There are several QI models. I am most familiar with Six Sigma and Lean. I have used total quality management. They all have similarities, and your particular hospital or institution probably uses one of them. I am not at all familiar with clinical microsystems, but again, your textbook does a nice job at just a broad overview of that model. Regardless, there are several steps and tools. They're all similar. I like to think of quality improvement in terms of the nursing process. Assessment, you have to assess performance by collecting and monitoring data the same way that nurses go in and collect data and do patient assessments. Then we make a plan. We analyze the data to identify a problem, and then we develop a plan. After that, we test it and we implement something, and then afterwards we evaluate it. So in order to collect data, we use tools and activity to collect the data. We have to know where we're starting to understand if we've made any change. Usually, just like EBP process, we want a team. We'd want to set a meeting schedule and meet regularly and use effective meeting tools. Take notes, make an agenda. There should be ground rules to each of the QI committees. Everybody should be involved in brainstorming. Nobody should feel that they can't contribute. Complete a structured assessment to understand more about performance patterns. So in order to do that, you need to collect data. I am one of the odd nurses and I love data. Data helps me understand what's going on and it helps me know if I'm getting to where I wanted to go. So collect data. We want to minimize performance variation. When we minimize performance variation, we improve quality. And that's in many of those models for QI, especially Six Sigma. Six Sigma looks to eliminate process variation. And these are some examples of tools in order to interpret some data. So the model for improvement. What are you trying to accomplish? It should be clear, almost like a PICO statement. What do you want to do? Be specific. How will you know that the change is an improvement? Use qualitative and quantitative measures to support the improvement and work as a guide to change the progress toward the goal. And then what changes do you want to make that will result in improvement? You'll want to go into the literature to see if it's been done before. And I'll tell you, a lot of it's been done before. So go out into the literature. Don't reinvent the wheel. Look and see what others have done, and then try to develop a plan that incorporates that evidence-based practice change. So this slide just shows themes for improvement, and your textbook does a good job at explaining all of those. Some hospitals use the Plan, Do, Study, Act, or PDSA improvement cycle. This focuses on small and rapid tests of change. It's helpful because you can see incremental progress that gets you to the endpoint. And you'll also want to track the stability and the sustainability of the new work. Maybe you've probably had some experience with sustainability. There may have been a grandiose plan to improve something, but it's a little bit arduous and it works for a short time, and then that skill decay happens. It's not sustainable. So you want to measure that sustainability over time. Definitely, nursing leadership has to be involved in QI. They should be leading the way in QI, supporting the activities of the committee, supporting the risks and the change, and providing resources. Leadership should be allowing staff time to participate in an EBP or a QI committee. And then finally, Improvement work is possible only when you have some professional knowledge, how to improve, and then linking these two knowledge systems together. And by doing so, you'll be a key player in QI work. If you have any questions about this presentation or any of the previous ones, don't hesitate to call me or drop me an email. You can also stop by my office or ask for a meeting. All of the information is in Canvas and also on the syllabus. Have a great day.